Meet Abdullah Al Hussein. He is the head of finance of Al Muhafiz Contracting Company, who is having more than 1,000 employees. He's really worried. It's time for the annual renewal of the health insurance, and the premium has increased by about 25%. The healthcare laws in Saudi Arabia makes it mandatory for the employer to provide health insurance to its employees. Because of this health insurance, the doctors can prescribe any sort of treatment, irrespective of the cost of the treatment. The employees go to private sector hospital thinking they're going to provide them better health care. On an average, a person in Saudi Arabia has 6.8 visits per person per year, which is 2 times higher than the developed world. Whereas 90% of these patients do not belong to the hospitals because they either have chronic diseases or minor ailments, which can be treated at the primary care or even at home. Despite spending a lot on healthcare, the employees have a poor patient experience. This is because of the traffic, the waiting time at the hospital, dependence of the elderly and the children on others who take them to the healthcare facilities, taking time off from the work. And if the patient goes to a hospital, which is a new hospital, then the doctor doesn't have access to the patient health records. Same goes for the pharmacies and the labs. So despite the employer spending high cost on healthcare, the employee is still not satisfied with the healthcare service. So we are MedIQ. We are connecting patients, providers, and payers through our integrated digital healthcare platform. We onboard health service providers, we get integrated with insurance companies, and help the patients seamlessly move between physical and online healthcare services with the tying factor of electronic medical records connecting everything together. The patient can book a consultation, either physical or virtual. The doctor looks at the electronic record of the patient, carries out the consultation, writes a prescription, which is uploaded in our system. The pharmacy orders or the lab work is done by our partner pharmacies and the labs integrated with our system. The reports of the patient get uploaded into our system, and the doctor can have a look at them and give follow-up instructions. All this is tied together with our unified medical record, including the remote patient monitoring. So our platform is completely digital. The patient can have access to the records from anywhere and irrespective of the hospital where the patient is going. So as a result of this integrated system, the stakeholders like the insurance company or the corporates are able to reduce the cost of the healthcare services. The patients have a better customer experience and get convenient healthcare services. And the hospitals are able to focus on high need, high cost patients. Let me tell you how it works. The customers or the employees download MedIQ's application from the App Store and create an account. They make a connection with the health insurance company already onboarded by the corporate and integrated with MedIQ. The customer books a consultation, either physical or online. The doctor has a look at the record of the patient. The prescription is uploaded into our system. The pharmacy and the lab services are provided to the patients through our integrated pharmacy and the lab service providers. All the data is entered into electronic medical records. So as a result of it, the patient has access to the data anywhere and from any hospital where the patient wants to seek the healthcare service. The corporates and the insurance companies have the dashboard where they can have a look at the usage and the cost data. Under Vision 2030, Saudi Arabia has healthcare as a priority sector. The shift is from public sector provision to the private sector provision, which is currently at 22% and is expected to increase to 60% by 2030. The population of Saudi Arabia is increasing and is expected to double from 38 million to 77.2 million in about 15 years. The current infrastructure is not going at the same rate, which calls for the insurance companies to look for solutions like MedIQ so that they can reduce the cost, but at the same time don't compromise on the quality of the service or on the patient experience. There are 6 insurance companies in Saudi Arabia who have more than 90% of the market share, and we are integrated with 2 of them. There are more than 83,000 large and medium enterprises with 8.3 million employers employed by them. Our targeted employees are about 2 million, which are going to help us generate 6.8 million in terms of revenues in the next 3 years. MedIQ is a unique combination of physical and online healthcare service provision, unlike our competitors, and is a unique solution in this space. We are fully digital, and we help our health service providers digitize their workflows, like pharmacy management, claims provision, and services. So we are digitizing the ecosystem. MedIQ is a unique combination of services and technology. And this is possible because of the team who is helping us, me and Dr. Saira, who is the CEO and founder, with a journey of healthcare and insurance experience, which started about 20 years back with KfW Development Bank, Allianz Insurance, and I was the founding CEO of the largest health insurance program in Pakistan, which is covering 60% of the population. I'm helped by Dr. Wada, our Chief Operating Officer in Saudi Arabia, who has more than a decade of experience in managing teams and running operations at large scale. He has worked with Ministry of Health and Saudi Arabia's first virtual hospital, Siha. The Chief Operating Officer in Pakistan, Jawad Rizvi, brings with him more than 21 years of experience from FMCG sector like Unilever, Procter & Gamble, and RB. We are helped by our tech CTO, who is a tech genius behind this user-friendly technology, and Sama Janjua, who is the key person behind the growth strategies in both the countries. Mara Ehsan is our Chief Financial Officer. With the help of the team and the tireless efforts which we have been doing in the last 4 years, MedIQ has seen a strong demand from its customers. In last year, 2023, we generated a GMV of $21.7 million and a revenue of $3.63. In Saudi Arabia, in just 9 months, we generated more than 260,000 GMV and the revenue of more than $86,000. We are growing on an average 16% month on month. And in addition, our customers love us with 96% satisfaction rate, and 58% of our customers reuse our services. We have helped the companies reduce their healthcare expenditure by about 22%. The numbers show this financial success, but at the same time also show the number of the lives which we have impacted. And we request you to join MedIQ. Be a part of MedIQ, because at MedIQ, we are not just imagining a better healthcare, but we are building it. Thank you.